The opioid epidemic is a serious public health concern that is running rampant in our country. Between 2002 and 2013, the number of opioid-related overdoses have quadrupled. We are also seeing increases in opioid use, both prescription and heroin use, in 18 to 25-year-olds, with 3 out of 4 current heroin users stating they abused prescription drugs like Vicodin, OxyContin, and fentanyl before turning to the cheaper alternative, which is heroin. Policymakers in the past have generally been conservative about treating this epidemic. However, in the past 15 years, we are lucky that policymakers have started to catch on. We can't get people to stop using drugs. It's unrealistic and not the way to focus our policies. Policies should be focused on education and prevention. Therefore, we need to work on encouraging education both in the classroom and out, so that people understand the true seriousness of this problem and eventually start to learn so much about it that it doesn't become quite as scary anymore. Anyone could be struggling with opioid addiction, which is what makes it so scary. Studies have shown increases in the use of opioids in both men and women, non-Hispanic whites and blacks, younger people, older people, and even in all regions of the country. With something so widespread, we need to find something that is universal and that is implementing Narcan education programs. Narcan, as we know, reverses an opioid overdose and has saved numerous lives. What better way to empower people than to tell them that they're learning how to save a life? Anyone can learn how to use Narcan, which goes to show you just how many people are affected by this epidemic. I think it should be mandatory for hospitals, primary care offices, and other common health areas such as those to host a certain number of Narcan education courses per month. People go to the hospital or the doctor's office all the time. It's more of a benign setting as opposed to a shelter or a community health center where someone may not normally go, which therefore just supports the stigma that drug use should be kept quiet in parts of town nobody wants to go. By holding these sessions in normalized settings, we can start to reduce the stigma associated with drug use. You never know when you could encounter a situation like an overdose. Some people feel that no one they know would use drugs, but what about people that they don't know? Aren't they worth saving too? In conclusion, if we don't work harder towards advocating for these victims, there will be no end to this epidemic. As future nurses, we can use our voice and our knowledge to educate the public, especially our youth, and hopefully start to see declines in overdose deaths.